Are you struggling to stay erect for long enough? Do you get erections, but they don't last? Or do you come too early and feel powerless to stop it? If this sounds like you, don't worry. Why am I here for? For instance, research indicates that approximately 30% of men experience PE at some point in their lives. So that means you are not alone. In this video, I'll explain why this happens, and we'll share 5 proven strategies that will definitely help you overcome these issues, so you can enjoy sex for a longer time. Because I believe early ejaculation is something that can completely be fixed, 100%, if you just adapt these strategies that I'm going to share in this video. So how common do you think premature ejaculation actually is? Well, statistics would suggest that up to 1 in 3 men have experienced it at some time. And in simple words, premature ejaculation, or PE, is a condition where a man ejaculates sooner during sexual intercourse than he or his partner would like. It's one of the most common sexual dysfunctions in men. So, why this happens? Well, it's kind of complex, involving a mix of psychological and physical factors. But one reason that I believe is watching too much porn and ejaculation too often almost every second day weakens your pelvic floor muscles, and it increases the sensitivity of the glands of the penis. Secondly, there are some common psychological factors include performance anxiety, stress, and relationship issues. So, if you or your partner are upset because of early ejaculation, it might be premature ejaculation. A key part of PE is feeling like you can't control when you ejaculate. PE is usually defined by time, but there's no exact agreement on how long. Most people say lifelong PE happens if you ejaculate in less than 1 minute, though some say less than 2 minutes. It's important to understand both the feeling of lost control and the stress it causes in your relationship. Okay, so there are 2 main groups of PE. The one is lifelong PE, and the other one is acquired PE. The lifelong PE is defined by early ejaculation every single time, starting with your very first masturbation to the first sexual experience. It occurs every time, in any situation, often within 1 minute or even less. It's early, it's under 1 minute, and it's sometimes even less than that. Now, acquired PE is something that develops later in life. For example, you might have started with a normal ejaculation time, which research shows is about 5 to 6 minutes after penetration for most people. But then, something changes, and you begin ejaculating much faster, like under 2 minutes. So this would be considered as acquired PE. Now, lifelong PE can sometimes be harder to define, because there's another type called perceived PE. This means you feel like you ejaculate too early, but in reality, your timing is completely normal during intercourse. Now there's also variable PE, which means your ejaculation time changes. It's short sometimes and longer at other times. Another type is pseudo-PE, which is linked to erectile dysfunction. In this case, because you're worried about losing your erection, you may rush to finish quickly, causing early ejaculation. However, it's important to know that having a short ejaculation time occasionally doesn't always mean you have PE. Physical factors may also be responsible for PE that might include hormonal imbalances, certain medications, and underlying health conditions. All right. So, here are top 5 strategies or interventions that are proven to help if you suffer from premature ejaculation. Number 1. Orgasm more than once and have more sex. What do I mean by that is, train your weapon. Like, this is a normal activity for him and get used to it. Well, you all know that typically, after the first or even second orgasm, it takes longer to achieve subsequent orgasms. Now, for some men, masturbating earlier in the day can help them last longer during sexual activity later at night, though this might not work for everyone, especially if you've had a long, tiring day. Okay, so number 2 is to reduce the sensitivity of the skin on the penis. There are a couple of ways to do this. One way is just to wear a condom. Some guys will even try wearing 2 condoms, although this is not a good idea if you're using condoms for contraception, because wearing 2 means it's more like to break. Condoms can reduce the sensitivity from sex, which might help you last longer. Alternatively, there are anesthetic creams. One in particular is known as EMLA cream, contains a mild anesthetic. As health professionals, we actually use it all the time, not for premature ejaculation. But, for example, if we need to take blood from a child and we want to numb their skin, we'll put EMLA on their skin before we insert the needle. Now, to get the EMLA cream, you might need a doctor's prescription for this. I know in United Kingdom or in Australia you do, and it often will last you for a while because you only need a small amount of the cream to be applied on the head of the penis for around 20 to 30 minutes before having sex to achieve a numbing effect. Okay. So, number 3. Try pelvic floor exercises. Strengthening your pelvic floor muscles can help you gain better control over ejaculation. Kegel exercises are particularly beneficial. Now, here's the catch. The most difficult part is to identify your pelvic floor muscles. To find your pelvic floor muscles, try stopping the flow of urine while you're peeing. You're not finished yet, but just stop the flow. The muscles you use to do that are your pelvic floor muscles. Now, what you have to do is contract these muscles, hold for 3 seconds, and then relax for 3 seconds. Repeat 10 to 15 times, 3 times a day, or whenever you pee. Number 4. Employ a technique like start, stop. Now, okay, this can take some practice and it may not work very well if you haven't had an orgasm for a while or if you're particularly horny. But the idea is that as you feel yourself getting to the point of no return with the orgasm, you stop. So, the stop-start technique is a really good one for couples. I've had a lot of patients report they have good success after they recognize when they need to stop and how long to wait before they restart. When you stop, just go drink water, go for some foreplay, and then you can start again. Number 5. By no means least, psychotherapy. I'm not saying that premature ejaculation means there's something wrong with you, but it's also not something to be dismissed as significant. Sometimes the root cause of PE is psychological. Consulting with a therapist or counselor who specializes in sexual health can be incredibly helpful. Therapy can address issues like performance anxiety, stress, and relationship dynamics. I have a lot of men who see me as patients struggling with this for years. Some of them to the point that they're actually scared to even engage in an intimacy because they're so self-conscious of ejaculating early. This can affect mental health and self-esteem. So, if all else fails and you've tried everything else, please reach out and talk to someone. There is a number of trained therapists who can help you in lots of different ways. Remember, premature ejaculation is a common issue, and you're not alone. There are many strategies available to help you manage and overcome it. If you're struggling, don't hesitate to seek professional help. I'd love to hear from you. So, leave a comment below if you have any questions. As always, thanks for watching. Bye-bye.